good morning,
Good morning.
Michelle. So today is your last appointment with me after you had your bunion and your hammer toe fixed.
Right.
How long ago was your surgery?
3.5 months.
Speak up a little.
About 3.5 months.
Okay, and so you had unsuccessful surgery before and you were still in pain.
Right.
And so we did quite a bit of preparation before your surgery to get everything lined up, because you did return to work very soon after your bunion procedure.
Yeah. I had to wear a boot, so I was essentially non-weight bearing on that, which was amazing to me because I was told that I would have to not bear weight, not return to work for 6 weeks. So this was much easier.
Because you could really walk right after the operation.
Right.
We just put you in a special boot and you put weight on the heel in the first couple of weeks.
Right.
But you're a physical therapist, so you were able to go back to work very, very soon.
Right.
Actually, sooner than I wanted you to, but I guess we didn't have a choice. So were you in a lot of pain after your operation?
Well, you know, the more I kept it up, the better it felt. The more I was walking on it and had it down, you know, it was sore and it would swell. But as it healed, like let's say 6 weeks later, the pain was much better. I could move my toes. You know, I think I was able to take the boot off, which surprised me. After just 3 weeks, I was able to walk without the boots on. And so I was able to wean out of it, and I started on physical therapy and got my toes moving, and so it's much better. I'm not having any pain now. Now, if I'm on it a lot, if I have to stand a lot, it will still swell, but the pain is minimal.
Yeah, and you're only 3.5 months, so it will only get better.
Right.
So, comparison to before the surgery, and I remember you were in a lot of pain because we even had to use some pain medications before the surgery just to keep you working until you could take some time off.
Surgery.
How much pain are you in now?
Well, I'm not on any pain medicine anymore.
Okay.
I'm not in any pain.
Okay.
So
for people who are contemplating about having foot surgery or living with their pain,
I would say have it done. Have it done before it's too late, because you know you need your feet all your life. That's the only pair you're going to get.
Exactly.
So if you don't get it done, then you're just going to have worse results.
Right. Well, and you're a big believer because we're doing your other foot.
Right.
So you know it worked on one foot.
Yeah, I want to make sure that I can get it done before I have so much pain.
Exactly, and that's the key. So, well, thank you so much.